And Tiger Talk brought to you by Health First Community Health Centers, Hancock's Neighborhood Market on Commerce Street, and Katie's Delicious Homemade Goodness, and Perry's Floors and More. Well, good Tuesday morning at 8:37. It's time for today's edition of Tiger Talk. I have the pleasure of welcoming into the WPKY studios Mr. Charles Hyder. He is the director of the Pennyrile District Health Centers. Good morning.
Good morning. How are you doing this morning?
I'm just fine, and it's nice to see you this morning, sir. And, of course, you came in from Hopkinsville, very, very busy this morning, and normally we're on at 8 o'clock, but I said, no problem, you just come on, and we have an important topic to talk about today. And, folks, if you're out there listening, you've probably heard about it in the news, and what we're talking about and discussing this morning is hepatitis A. This is a very contagious virus, and there's been an outbreak in the state of Kentucky recently, but Mr. Hyder is here to tell us a little bit more about that. There's also new requirements for vaccination. There's a vaccination out there. So good morning, sir, and we'll get right into it.
Hey, good morning. Thanks very much for having me, and thanks for this opportunity to talk about the hepatitis A outbreak in the state of Kentucky. It's nothing new, so that's the one big thing. In last October is when the actual state declared an outbreak for Kentucky. Hepatitis A started up in the Louisville metro area, and they started doing the research with CDC to figure out where it came from. It's a virus, and over the year, though, we haven't really gotten it under control. Mm-hmm. And so about 2 months ago, we had the most cases of hepatitis A across the Commonwealth in the nation.
Yeah.
So that brought it back to the forefront for us here in our area that we service, our 5 counties, and just wanting to make sure everyone's aware of it. So,
right. Of course, there was over 1,000 cases in the state of Kentucky as of August 1st of 2017 through June 30th of 2018. And we ought to say that hepatitis A is a virus that attacks our liver.
That's right. It is a virus that attacks our liver. It is the primary and historical primary way of being spread is through poor food preparation, fecal matter distribution.
Right. Somebody goes to the bathroom and
doesn't wash their hands very well, something like that. However, this case, what we're seeing a lot of transmission going on is through intravenous drug use, and the homeless population.
Right.
So one of the things the scientists do whenever this happens is they start looking at it, and they've actually tracked this main strain of it that they're looking at to the homeless population out in California, Los Angeles or San Francisco area.
So some transient maybe has come into the state.
Exactly, and brought the virus, or someone on vacation, like you and I were talking about before we got on. This is one of those viruses that if we don't get vaccinated for your hepatitis A, or 2, just take those measures to wash your hands, wash your foods and fruits and vegetables. Make sure everything's prepared right. You can stop it, but if you don't take those simple steps.
Yeah, and hand washing is very important, but it could be as simple as being in the produce section of a grocery store.
That's right.
Somebody has handled, an apple. You decide to pick it up and eat it. It's not very clean, and then boom.
That's right, and that's the key. Yeah. That is the key. I know. I mean, a lot of us have grown up in this part of the country, out on the farms. You're walking through, you pick up the apples and stuff like that. Well, that's one thing. And when our 5 counties right now, we have 0 cases, and we want to keep it at 0.
That way. Right.
That's right. That's our goal right now, is to keep it that way. But we do have some counties around us that have had a couple cases. So take care when you're traveling, when you're out doing stuff, making sure you're washing your hands. We're a much more global community and a lot more transient people. So,
and that's an important key is washing your hands.
That's right.
After you go to the lavatory. Just anytime you might be in a public spot, take a second and, good hand washing, that's a good practice to have anyway.
That is a good practice. Good hand washing, using this hand sanitizers,
sure.
Those seem to be everywhere. You need to do it. It's like an insurance policy.
Yeah.
You can't control everyone else. All you can do is control what you do. So
exactly, and there's so many of us. We're out in the public all day long, but you get an itch on your face, and I mean, it's just so easy. Your hands and everything can just be near your mouth, your nose, your eyes, and next thing you know, you've got a virus. That's how most viruses spread.
That's
that
right.
way. But let's talk a little bit as well about. Not only do we have an outbreak in Kentucky, but the law has changed for our students.
That's right.
And in this vaccine.
That's right. So about a year and a half, 2 years ago, the process was starting to change the law for 2 new immunizations required for students in schools. The first is the hepatitis A. Hepatitis A has always been a vaccine that has been encouraged for children, but it's always been an optional. Parents and doctors had some options on if they had the vaccines or not. We have some of the other hepatitis vaccines are required, but hepatitis A wasn't. So last year, it was put into place through statute that hepatitis A would be required for all students entering school. It is a 2-shot series, and so they gave last school year the time to get everyone up. And here across our 5 counties, we did some vaccine clinics where our clinics stayed open later at night. And end of January, 1st of February, but we're promoting it before. That second shot has to happen 6 months later.
Yes.
So if you came into one of our clinics and got your shot, you're going to be starting school out of tolerance. We'll tell you that right now. Mm-hmm. Talk to most all the schools. They understand that as well. Mm-hmm. But we're going to have another clinic as well at the end of August to get that second shot. So we're going to be
real close anyway.
You're going to be real close. The schools know we're working with you to get your immunizations in.
Right.
So we'll be doing those clinics. Get hold of your health department. Find out when. I believe they are all that last week in August, August 23rd here in Princeton.
Right.
So,
and of course, the Pennyrile District Health Department. They cover 5 counties here in West Kentucky, and those, of course, are Caldwell, Crittenden, Livingston, Lyon, and Trigg County. So those dates could be different if you're listening outside of Caldwell County, but in Caldwell County, it is the 23rd of August. So that's just right as school's starting.
That's right.
Just right
it's
there.
It's that first week.
So if you get that second shot, you're good to go.
That's right. And then the other immunization out there was the booster for meningitis booster for 16 and over. So now, I mean, you're not done getting shots at your 6th grade year anymore. You got to go back in your sophomore, junior year and get another one.
Right. Now, a lot of the college kids, that haven't had that to booster are getting it as well because I've got one going off to college. He recently received it. So.
And that's the key. We want that college age. So parents that are out there, kids that graduated last year, they're like, hey, I don't need to worry about that hepatitis. I'm going to college. Not a good answer. Yeah. Some colleges are requiring them. A lot of schools have their own immunization requirements. Yes. So look out to your college and ask your colleges, what are your requirements? But both hepatitis easily spread on college campuses, partially because you have a lot of international students, and hepatitis is more prevalent in other countries. And so those students are coming into our country, and so your risk is increased with that great opportunity of studying with people not from America or even West Kentucky. So that group, and then meningitis. It's a fast, scary acting disease. So get the protection.
No doubt about it. And of course, hepatitis A, we were talking about, affects the liver. Symptoms usually start 2 to 6 weeks after you're infected, but a lot of symptoms: fever, tiredness, loss of appetite, nausea, vomiting, and of course, abdominal pain. The big ones, though, for really when it affects the liver, dark urine and jaundice, is indicative if you get that. And for most people, you don't want it because it's your liver.
That's right.
I mean, you only got one.
You only have one.
But a lot of times, with proper treatment, it runs its course. But there are some that have autoimmune disorders and other health problems where this can be complicated for them, and there have been deaths associated with it because of secondary problems and complications with health.
That's right. So, and right now, for most of our physicians and all here in Kentucky, if you go in with a lot of those symptoms, a lot of your questioning is going to go down to where you've been eating, exactly. What is your interactions, what's your environmental effects, to have them look at hepatitis and then getting the blood test and all for those viruses. But it can be more dangerous for the young and the old,
yes.
Or someone with a complicated immune system, yeah. And having an issue there.
So it's nothing to fool around with. And, of course, you can get vaccinated at your local health department easily. Even if you're an adult, you can take the 2-shot series because that's what it takes. And, it's just as simple as calling up your health department, making an appointment, and they can get that.
And exactly. And that's what we're encouraging. It's like most all of our vaccinations for viruses. Again, viruses are something that we can't really treat with medicine.
No.
You can only treat the effects of whatever illness you have. So taking those preventive measures, even if you are exposed, we're reducing the impact. And hopefully you won't get it, but if you get it, it won't be as bad.
As severe. That is correct. So lots of things to consider. Of course, let's go back and talk about the prevention of hepatitis A. That vaccination is very important to get the full benefit. More than one shot is needed, and it's of 6 months apart. But the main thing is practice that good hand hygiene, thoroughly washing your hand after you go to the bathroom, changing a baby diaper, anything like that. And if, make sure you take that extra step if you're eating out or preparing food to wash your hands thoroughly. And I'm not talking about just sticking them under there and just rubbing them for a second. You need good hand cleanser, soap, water, pretty warm water.
Some warm water, that's right. That's right, warm water.
And I would say hot, borderline hot. We know that the temperature, not to burn your hands, of course, but and then, of course, scrub your hands and rub and give it some friction.
Yeah, that's exactly right. And so just being aware of those things, taking those cautions. And then we'll go to, I would say, the extreme that's out there. I'm sure I'm not naive enough to say there aren't any, but I'm sure that listening in here, we may have some intravenous drug users. If you're sharing needles, don't.
Yeah.
We don't have a syringe exchange program in any of our 5 counties. That the needs to push for those haven't really presented in our 5 counties. But if you're using intravenous drugs, first off, I would encourage you to get with us so we can get you with a local organization to stop.
Yeah.
It's not good for you. It's not good for your family. So I would first encourage that. 2, let's take the measures to make sure if you are doing it, you're doing it in a safer to you manner than sharing needles with others that are around in order to prevent that.
Yes.
And let's first help you stop the drug use, but 2, let's make sure we're limiting this risk of a spread.
Yeah, no doubt about it. And it's easy as calling your local health department for more information to schedule that appointment for that vaccination, because this prevention aspect is key. Hopefully, the CDC, the state of Kentucky, our medical providers and folks are on top of this and have an idea. That's why we're being proactive here and talking about this, so we can kind of stop this, so to speak.
We're at 0.
Yeah.
We're at 0 in our 5 counties.
Exactly.
Let's stay there.
Let's stay there
because the counties that have had some are right on our borders.
They certainly are.
So we just need to be aware of that. And like you said, call, make an appointment. I mean, my nurses will probably, I'll probably have a stack of emails before I get out this door. All 5 of our clinics are also walk-in as well. We do appointments and walk-in. So if you're hearing this now and you say, hey, I got an hour, swing on by the health department and say, hey, I need a hepatitis shot.
Yeah, that's
and they will take care of you.
And the number here in Caldwell County for our health department, of course, it's located out at 600 South Jefferson Street, is 270-365-6571. Again, 270-365-6571. And remember, if you're a student, you've got to have, if you've not been proactive and taken that first dose, you need to get that first dose down.
Now.
And then in 6 months, you'll take that second one. And if you're an adult, especially if you have some medical issues, it might be time to do that, because if you were to get the virus, it could cause you some problems. It's problems for someone that's healthy as well. So if you're out there thinking, hey, I don't need this, it might be something to consider.
That's right, and that's key. Always good to have it. Prevention is key in everything. Being good at the individual prevention level helps us at the regional level to keep something at bay.
That's right. And, of course, be careful about where you're getting your information about this. The best place is, of course, from someone local, maybe your local medical provider, the local health department, of course, and then, of course, the CDC, the Centers for Disease Control. They have a website, and that's cdc.gov. So not trying to scare anybody, of course, but just wanting us to stay proactive and stay out in front of this.
That's exactly right. And if you're a business owner that has some food preparation, or some of our gas stations that have food counters that people are picking stuff up, if you would like, swing by the health department. We have made some flyers, or give us a call and we'll drop them off for you. Inside, fold out, trifold is just the poster you can stick up to remind people to wash their hands, get vaccinated, and the outside just provides some thinking points for you. So if you need something to help remind people, a little bit of a picture, go ahead and let us know, and we'll get you one.
That's awesome. Have we covered everything?
Back to school.
Yeah. All
those vaccines that you need to get, physicals as well. If you need to get your back-to-school physicals, get in to get your physicals. You 6th graders, kindergarten, 6th grade, get your eyes and your ears checked. That you can't. There are the big things that people think about. Then there's some little things that they forget about. Your eyes and your ears, especially for your younger kids that don't necessarily know how to say, "Hey, I'm not hearing all the teacher's saying. When she's facing the chalkboard, I'm missing it."
Right.
Well, they don't know to say it.
That's right.
And they've been off all summer. Your eyes. I mean, gotta love the sun, but sun does damage to eyes. So if you're pulling out some stuff and you're seeing your kids moving the books around a little bit more, ask them. Take them to an eye doctor, or come by and we can do a simple screening and make a recommendation. Dental. That's the third big one that a lot of people forget about. Kids that need their teeth checked and get your fluoride varnish. We have programs in our health departments as well that help with fluoride varnishing for kids up to 5th grade.
Great.
It's not just for the babies.
Right.
If your teeth are hurting, you're not concentrating in school.
No, that's right.
So make sure you're taking care of your teeth as well.
No doubt about it. That's a great point to make, because if you have a toothache, or if the board is blurry, it's frustrating. And then sometimes you don't always talk out and speak out and go, "Mom, Dad, I've got this," and it's discovered, maybe down the road.
That's
so.
right. We got a lot of schools doing a lot more on computers than it was when you and I
Big
were in
time.
school. So
Big
you're getting
time.
headaches and stuff like that. So let's take those measures now. I know summer's coming to a close, but
and it's very convenient, folks, to get to your local health department here in the Pennyrile district. Again, 5 counties to serve you here in Caldwell County, Crittenden County, Livingston County, Lyon County, and Trigg County. That's what they're there for. That's what they do. And good reminders from our health department. Charles, it's always a pleasure to have you here. We certainly appreciate what you all do, the staffs at all our health departments, keeping us healthy. And, of course, folks, if you're out there listening or watching via the stream, the health department is a great resource for health information, it could be anything that you have. You reach out to that resource, and those fine folks in our local health departments are very knowledgeable. And if they don't know, or if it's not something that they can do there, they will definitely recommend somewhere where you can get that help that you need.
We do. We have a lot of programs out there. They're not just all clinical.
Exactly.
We focus a lot on prevention and positive health lifestyle. So
Yes.
come by and ask.
It's very, very important. Well, sir, thank you so much for making us aware of this. And don't forget, if you have not had your child, your student, to get their hepatitis A vaccination, you need to do so. You need to get that first dosage in, and then 6 months later, if you had that first dosage, there will be a clinic here in Caldwell County on the 23rd of August. You can get that second dose. And if you haven't had the first dose, I guess you can get it there as well.
Well, you can get your first dose then, but we'd rather you come by before so we start school with at least one dose on the record.
And get the clock starting.
That's right.
So you can get covered and taken care of it. If you're an adult out there and have concerns and feel like it's something that you need, then that's something you can do as well. Thank you so much, sir, for being here. We certainly appreciate you and your staffs here in our Pennyrile district, and we hope to have you back soon.
Thank you very much. We enjoy helping out the community.
Okay, that's great. That's going to wrap up this edition of Tiger Talk here on your hometown radio station, 103.3 FM, 1580 AM, WPKY, The Tiger, Ty Englebright, and our guest today, Mr. Charles Hyder. He's the director of the Pennyrile District Health Departments in our area. Again, in Caldwell County, if you have any questions, concerns, would like to schedule an appointment to see someone out there, 270-365-6571. In Crittenden County, 270-965-5215. In Lyon County, 270-388-9763. That's going to wrap up Tiger Talk for this Tuesday. Tomorrow's Wednesday. It's our extension program, and be sure you tune in for that. For Charles Hyder, Ty Englebright, have a great day, everybody.
Get ready for back to school with Health First Community Health Center, offering back to school physicals and immunizations. At Health First, we offer affordable, quality health care for the entire family. Call us to make your appointment today at 1-877-667-7017. Same-day appointments available, and walk-ins are always welcome.